Dr. Scavella, you heard, to follow up on Senator King's closing comment, you heard the testimony that occurred just moments ago. What's your takeaway? We heard correctly that there's lots of praise and appreciation for the VA and its capabilities of dealing with veterans and their caregivers. But what did you learn that you and the VA should be doing different or better? And was there something that you want to highlight for this committee that we ought to be doing to help you accomplish that?
So thank you for that question, Chairman Moran. I will say that we are very proud that we are partnering with each of the folks on your first panel. We worked extensively with Dr. Hoover to improve the care that's being provided for patients with ALS based upon her direct input. She, in her testimony, did name one of the two physicians that we were able to assign to assist with ensuring that her voice and other voices are known. Mrs. Ward, Ms. Bailey, and Mr. Thomas also talked about the extensive partnership that we have had. So I'm very pleased to hear their testimony today, and we look forward to continuing to work with them to learn about what's not working, what we can improve upon, and anything new that comes up as healthcare evolves and innovates and improves.
Well, let me raise a couple of topics then. The Congress, Dr. Scavella, has allocated the full amount of funding that the VA has requested for medical services. Has there been any hindrance in making certain that SCID systems of care receive the necessary funding to provide the complex level care needed for these veterans? In other words, the VA asked Congress in their budget for this amount of money. We've appropriated this amount of money. The VA has that. Is it getting to the care and treatment programs, the care programs for these veterans that were described today?
Yeah, thank you for that question. We are not aware of any challenges. I know that there was focus in the previous panel about staffing. It has been made clear, and we've communicated it, that we have an exemption for the caregivers that are providing direct patient care in our system. That includes our clinicians, our nurses, our physicians. That includes our social workers. That also includes those folks that make sure that the space is clean and safe for veterans to receive care. So in my understanding, we have adequate funding and are able to use those funds appropriately. When looking at our staffing from September of 2025 and comparing it to a year ago, it appears as if we have the same exact number of staff assigned to spinal cord injury and disorders. Where there may be some differences perhaps are with the differences in the categories, and we'd be happy to take that back to make sure that we are still meeting the intent.
It is, it's been brought to our attention that at least in a commentary, I would say is the way that I would describe this, that the VA spinal cord injury and disorder system is understaffed, and it's the challenge of hiring and retaining highly skilled providers, particularly in rural areas. I think you just testified that the same amount of staff in this arena within the VA, it's the same as it was a year ago. Are there differences of the different challenges depending upon where those programs are located or where the veteran resides and needs care?
Yeah, so I'll highlight that a bit. We know that there can be some challenges, but with healthcare in general, not just within VA, for both attracting, recruiting, and retaining the talent that we need to provide this skilled care. We do have a number of modalities I'll let Dr. Wickremasinghe outline related to how we can address those care needs in a rural setting.
Thank you very much. Doctor.
Thank you very much for the question, Mr. Chairman. You know, we recognize that providing care to our veterans located in rural areas is critical. We rely on transportation and telehealth in addition to our spoke clinics, which really enhance our outreach. Our spoke clinics are located in areas closest to where our veterans live many times. And that, in combination with telehealth and transportation, really, are where, for us, the money is, when trying to reach our rural veterans. So for example, with telehealth, we have the VA Eastern Colorado healthcare system that has expanded rural healthcare to VA Black Hills healthcare system. So we have SCID specialists who can participate in appointments with veterans who are served at Fort Meade in South Dakota. So this is occurring in many VAs. In addition, we have telemental health. We have dedicated mental health providers within our interdisciplinary teams within our centers. So we have psychologists specialized in the care of veterans with SCID participating through telemental health to reach our veterans. A third example would be our telewound programs. Our veterans with spinal cord injuries many times have skin conditions resulting in pressure injuries. And instead of having our veterans drive in for follow-up appointments, we are able to use 3D imaging and cameras to see the wounds in real time and have our clinicians monitor progress. Sometimes it also allows us to bring our veterans into our centers sooner than later when we see any changes in wounds.
Thank you. I'm going to ask another question and turn to Senator Blumenthal. And I'll continue with you, Doctor. How does the VA, we heard the circumstance described by our first panel about lack of knowledge of programs, where to go, and then the silos within the VA that make continuum of care a challenge, or the length of the necessary components of care to be coordinated. What would you tell me about that, whether it's a problem, a challenge, how's it being addressed? What would you tell the first panel about that circumstance?
Thank you for that question. I'm not able to speak for the ALS system of care. Within the SCID system of care, however, we provide an interdisciplinary, comprehensive, lifelong continuum that I mentioned earlier with our senator. And I can take that back for the record and get that information to you through the subject matter experts.
What does the VA do to educate and help connect veterans with opportunities to participate in clinical research trials?
VA is a nation's leader in healthcare research, Senator, and we currently have about 27 VA-funded trials and projects focused on veterans with spinal cord injuries and disorders. We have, for example, the Rehabilitation Research and Development Gordon Mansfield Spinal Cord Consortium located in California, works with many VAs and the UCLA branches to focus on stem cell research. We also, for example, in West Haven, Connecticut, we have a Rehabilitation Research and Development Center focused on addressing neuropathic or nerve pain, the chronic pain that affects many veterans with SCID. And so on and so forth. I could provide you much more detailed information for the record as well.
Thank you. Let me turn to Senator Blumenthal.